Hi everyone, I'm joined by Bettina Liu today. And in this screencast, we're going to give you an example of what I call hypothesis driven history taking. As I've mentioned in the past, whenever you're talking to a patient and gathering a history, you're acting like a detective and trying to figure out the mystery behind this patient's story. Now, if you look at this schema for how diagnostic reasoning works, the most important thing to start off with is really having a good knowledge of illness scripts. And as we gather the patient's history, what we're doing is we're comparing the patient's story, translating it into a problem as physicians represent it, and generating hypotheses that match our known illness scripts to achieve a diagnosis. So this is what I would recommend to you as a novice learner. In advance of seeing the patient, it's important to develop a strategy. So when I go see a new patient and I know what they're presenting to the hospital or the clinic with, i.e., what their chief complaint is, the first thing I do is I review the framework that I'm going to use to consider that chief complaint. And I go over the illness scripts in my mind so that I have a sense for how I'm going to approach the questioning. So for a patient like today, we're going to be using the anatomic approach to abdominal pain, and as you can see, this is what framework we're going to use if we have a patient with localized abdominal pain. There are a lot of diseases, and so what I do is I review the basic illness scripts that I need to remember to cover the common diseases that present with abdominal pain. After that, you ought to fully characterize the symptom when you see the patient. Consider your most likely diagnosis as you gather the history of present illness, focusing on illness scripts and risk factors. At this point, one of the things that you ought to do is ask the relevant review of systems questions from that particular system. So in this case, we're going to be going over all the GI questions in the review of systems in the HPI so that we can fully characterize the problem. I then think about the alternative diagnoses and start questioning the patient with those alternative diagnoses in mind. That's when the HPI ends. At that point, once I have considered my alternative diagnoses, I then move on to the past medical history and surgical history, the medications, and so on. If the elements of the social or family history are relevant to the chief complaint, I may choose to ask that in the HPI. I then complete the interview with a review of systems, trying my best not to repeat questions that I previously asked. That way, the patient does not get the impression that I have not been listening to them. So I'm going to have you watch a video of me interviewing Bettina playing the role of a patient by the name of Sharon Smith. Good morning, Ms. Smith. I'm Dr. Esquivel. I'm going to be the doctor taking care of you in the hospital. How are you doing this
Hi,
morning?
doctor.
Hi.
I've had better days.
Yeah. I saw that you came in overnight with belly pain. Is that right?
Yeah, really bad stomach ache.
Okay.
Worst I've ever had.
Is that right? I'm sorry to
Yeah.
hear that. Did you? I saw that they had given you some morphine. How did that help?
Oh, is that what it was? Yeah, it really helped.
Okay. All right. Tell me a little bit about the pain. When did it start?
It started last night, and it just never went away.
Okay.
And this morning, it was still there, and it was really bad. So I decided to come in.
But the morphine made it better.
The morphine helped a lot.
Okay. And can you point to me where the pain is?
Oh, it's like right in the middle, like right here.
Okay. And has it kind of stayed there, or has it moved at all?
No, it's just in the same place.
Okay, so it's kind of like right below right above your belly button.
Yeah, like maybe like 10 centimeters above it, like a fist above it.
Okay, gotcha. So a little bit higher than that. Okay. And does it go anywhere?
No, it's just been in the same spot.
Okay. And what does the pain feel like?
It's kind of dull, but like really intense.
Okay.
And I kind of feel it in my back too.
Okay. It does go to the back a little bit. Okay. And on a scale from 1 to 10, with 10 being like the worst pain you've had, um, how bad is the pain?
Now it's at like I'd say a 4, but it was really bad before, like maybe 7.
Okay. Does the pain kind of stay there the whole time, or does it come and go?
It is there the whole time. It kind of gets a little better if I adjust how I'm sitting or lying, but then it just comes back.
Okay, so when you move around, it actually makes it worse sometimes.
It so if I bend over, it gets better for a little while, but then it just comes back and it's
Okay.
as intense as before.
Have you been able to eat anything or keep anything down?
No, 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 I haven't been eating anything. And I felt really nauseous this morning when I woke up.
Okay. Have you vomited?
Yeah, I've threw up like 3 times this morning.
And what did you vomit up?
Like I guess looked like food maybe, and some streaks of red.
Oh, so there's a little bit of blood, you think?
Yeah, I think that might be it.
Okay. And how many times did you vomit, you say?
3 times.
3 times. Okay. And are you moving your bowels?
Yeah, I haven't had any issues with that except that it's been a little bit looser than normal.
So when was your last bowel movement?
I think maybe yesterday.
Okay, so you haven't had any bowel movement since the pain started.
No.
Okay. And are you passing gas?
Yeah.
Okay. And the last time you had a bowel movement, was it normal in color?
It was a little lighter, maybe I would
Okay.
say,
Was
and
it?
it smelled really bad.
Okay. And was there any blood in it?
No.
Okay. And you said that the pain started last night. Was it after you had eaten something?
It was after I had dinner with some friends.
Okay. And what did you have for dinner?
Shrimp pasta.
Okay. Is anybody else kind of sick at this time?
Not that I've heard about.
Oh, okay. Have you had any fevers or chills?
No.
Nothing like that. Okay. And have you had anything like this before?
Not anything this bad. I mean, I get stomach aches from time to time.
Okay. What are the kinds of things that kind of bring on your stomach ache?
It kind of just comes. Not, I haven't noticed any like particular time or pattern to it.
Okay. And have you taken any medications recently?
I had some Malox this morning because I thought it would help, but it didn't.
It didn't help. Okay. Do you take any medications like Advil or ibuprofen or aspirin?
I take some Aleve,
Okay. And how often do you take a leave?
maybe 3, 4 times a week.
Okay. And how long have you been taking a leave?
Oh, probably a couple of years. I take it for headaches.
Okay. Uh, for years now. So about 3 to 4 times a week, you said?
Yeah, like 3 to 4 extra strength Aleves.
Okay. Have you ever had any blood in your stools or black stools?
No blood, but sometimes it's black.
And when was the last time that you noticed it was black in color?
Maybe like a week ago.
Okay. All right. What was there anything else that you had with your dinner besides the shrimp pasta?
Just a regular dinner with friends.
Okay. Did you have any alcohol with that?
Yeah, a little.
What do you mean by a little?
Like some wine.
Okay. And how many glasses of wine did you have?
Wasn't really counting. Maybe like three glasses of wine.
Okay. And is that unusual for you, or do you drink that much alcohol?
No, that's not unusual.
Not unusual. Okay. All right. In addition to the belly pain, have you noticed any your skin changing colors or like turning yellow, for instance?
No.
No. Okay. All right. Okay. I'm gonna. I think I have some ideas about what might be going on, but I kind of wanted to ask you some additional questions just to make sure that it's clear to me that I'm not missing anything. Okay.
Sure.
In addition to the belly pain, have you had any problems with like chest pain or heaviness over
No.
your chest? Nothing like that.
No.
Any palpitations? Have you been
Nothing
short
like
of? Nothing. Okay. Any shortness of breath at all?
no.
No. And any so you told me that you didn't have any fevers or chills. Any coughing?
No coughing.
Okay. Have you ever had pneumonia before?
No.
Nothing like that. Any trouble urinating?
No.
No. No burning or pain when you urinate.
No.
Any blood in your urine that you've noticed?
Never.
Any pain in your on your sides? Because you
No.
told me you have pain in your back, but not in your sides. Okay. And tell me about your menstrual periods.
They're pretty regular since I've been on the pill.
Okay. When did you start taking birth control pills?
Oh, a long time ago. Maybe 10, 12 years.
Okay. And your menstrual periods, you said they've been pretty regular.
Yeah,
And when was your last menstrual period?
about 4 weeks ago.
Okay. All right. And do you get a lot of menstrual cramping?
Not so bad.
All
Not
right.
since I've been on the pill.
Okay. And I'm sorry, how old are you?
I'm 36.
Okay. And when did you have your first? When did you start having menstrual periods?
Maybe 11 or 12.
Okay. And before you started the pill, was it regular or irregular?
It was pretty irregular.
Pretty irregular. Okay. And about how many napkins or tampons do you usually use when you're in your regular cycle?
Now or before?
Now.
Like maybe 3 on the heavier days.
Okay. And are you pretty good with seeing your gynecologist?
Yeah.
Okay. Have you had a pap smear recently?
Last year, I think.
Okay. And are you sexually active?
Mm-hmm.
Okay. With men, women, or both?
Just men.
Okay. And any history of sexually transmitted illnesses?
No.
Okay. All right. Any chance you might be pregnant?
I don't think so. I'm on the pill and I always use protection.
Okay, we can certainly check that. I think it's going to be important just to make sure.
Sure.
And anybody with any history of uh, uh, belly problems in your family?
No.
Nothing like that. Okay, all right. Okay, so in addition to the migraines that you have from time to time, any other medical problems?
Nope. Pretty
No?
healthy.
Yeah. Have you ever had any surgery?
Oh, yeah. I had my gallbladder taken out about a year ago
Okay.
because I was told that I had stones and it was giving me pain after I eat.
Oh, okay. And is that pain similar to what you're experiencing right now?
No, it was that pain was to the side and it
Okay.
would kind of come and go, and this is like not like that at all.
Okay. So you said about a year ago was when you had your gallbladder out. Okay.
Yep.
What about have you ever had an appendectomy?
No.
All right. And no problems with high blood pressure or diabetes?
No.
Okay. And have you been pregnant before?
Yeah, twice.
Twice. Okay. Tell me about that.
Well, the first time was when I was, I think, about 19, and I wasn't ready at that point, and I had an abortion. And then when I was married, I had a miscarriage.
Oh, okay. And which, how far along were you in the pregnancy?
About 9 weeks.
Okay, so pretty early on. Okay. And do you take any medications besides the Aleve and the
And the pill.
okay. Do you take any vitamins?
Just vitamin C.
Okay. Any other supplements that you take?
No,
Okay. Are you allergic to any medications?
no,
Okay. Any seasonal allergies or anything like that?
no.
Okay. Is there anything that runs in your family?
Mm, no, aside from my dad, everyone is pretty healthy.
Yeah. Tell me about your father. Is he still alive?
He's not. No, he died from pancreatic cancer.
And when was that?
He was 55 at the time.
So how many years ago did he pass away?
Like 7, 8 years.
Okay. And your mom?
She's good.
All right. Do you have any siblings?
I have a brother. He's pretty healthy.
Okay.
We
All
don't
right.
keep in touch.
Okay. And tell me about your living situation. Who do you live with?
I live alone.
Okay. And where do you live?
I live on the Lower East Side.
Okay. What kind of work do you do?
I'm kind of in between jobs right now.
What kind of job? What kind of work were you doing before?
I'm a lawyer.
Okay. All right. And how long have you been in between jobs or unemployed?
Like 3 months now, I guess.
Okay. All right. And you said that you're sexually active. Yeah. Are you with a regular partner at the moment?
Yeah, I have one partner.
Okay. And how many partners, sexual partners, do you think you've had in the last 3 years?
3.
Three. Okay. And do you smoke?
No.
No.
I used to smoke. Well, I'm trying to cut down. I used to smoke more, but now I just smoke socially whenever I'm out with friends.
Okay. And how much do you smoke?
Like a few cigarettes when I'm out.
Okay. And when did you start smoking?
Like when I was in college.
Okay. Um, and what about any drugs? Marijuana, cocaine, anything like that?
Yeah, just some weed when I'm out.
Okay. Any history of any IV drug use?
No.
No. Okay. And tell me again, how much alcohol do you usually drink?
Just like regular amount. Like when I see friends. I don't really count how many drinks I have.
Okay. Um, I was a little concerned about your alcohol use because sometimes that can cause some issues with belly pain. So I wanted to just ask you a few additional questions about that. Have you ever felt like you needed to cut down on your drinking?
I haven't felt that way. I mean, my ex-husband did, but
Yeah,
he just didn't really get it.
yeah. So have you felt were you annoyed by him criticizing your drinking?
I mean, we got divorced. What do you think?
Okay. Have you ever felt guilty about your drinking?
Not really. I mean, I don't think I'm bothering anybody.
Okay. And have you ever felt you needed a drink like first thing in the morning?
Not need, no. I mean, sometimes I have one to help with a hangover.
And how often does that happen?
Here and there. I mean, not too often.
Have you ever had like shakes or anything like that in the morning when you wake up?
No.
Like that. Okay. All right. I'm going to ask you a few more questions um, just to make sure that I cover everything. All right.
Okay.
You told me that you have problems with migraines. How long have you had that?
I feel like at this point, I feel like I've always had it, but it's not too frequent.
Okay. And whereabouts do you usually get your headaches?
Just kind of like all over, throbbing.
Gotcha. Okay. Any problems with like losing consciousness?
No,
Okay. Does it ever happen that all of a sudden you couldn't move your arm or couldn't move your leg?
oh gosh, no.
Okay. Any problems with numbness or tingling in your hands or your feet?
No,
Something like that. And any trouble with your vision? You wear
no,
glasses, I see.
yep,
Okay. Any trouble with your hearing?
nope,
Any trouble swallowing?
nope.
Okay. And you told me that you haven't had any cough. Do you have any trouble feeling short of breath when you're walking?
No, I'm pretty healthy. I go to the gym regularly,
Yeah. Okay. How often do you go to the gym?
like 3 times a week.
What kind of work? What kind of stuff do you do at the gym?
Like usually aerobic stuff.
Gotcha. Okay. And you said that you didn't have any chest pain, and you said that you don't have any palpitations or irregular heartbeats, anything like that.
No,
Any swelling in your legs that you've noticed?
no,
Okay. I think I already asked you about your belly stuff. I already asked you some questions about urinating. Any trouble with like urinating a lot more than usual?
no,
No. Okay. And any problems with your with pain in your muscles?
no,
Any trouble with like pain in your joints?
no,
No. Your joints don't bother you, stiffness or anything like that.
no,
Okay. Any swelling in your hands or your joints? Nothing.
no.
Okay. And any trouble with weight loss or weight gain?
I think I may have lost a few pounds in the last like month or so.
Is that intentional?
I wouldn't say intentional.
Okay. All right. And what do you think about your stress level?
I mean, it's been a little bit better since I left my last job, but being in between jobs is also not so easy.
Okay. You would say that your job is pretty stressful.
Yeah, it was. It was
Mm,
very stressful. I had so many clients that I had to deal with.
I see. Okay. And do you feel like you have enough of a support system?
Yeah, I mean, my boyfriend has been really supportive, and I feel like I can relax when I'm out with friends.
Okay. Any problems with depression in the past?
No,
What about anxiety?
I think I'm a pretty anxious person, but I
Yeah.
mean, nothing like a panic attack, if that's what you mean.
Okay. And how do you deal with your anxiety usually?
I mean, going out with friends helps.
Hmm. Okay. And any problems with like hearing voices or seeing things that aren't there?
No, no,
No. Okay. And any history of physical or sexual abuse in the past?
no.
All right. Okay. Well, is there anything I've missed?
What do you think is going on, Doc?
Well, I think what I'd like to do is I'd like to do a physical exam, and then I can review with you. Once I'm done with that, I can review the labs with you, and I can kind of tell you what I think might be going on. Okay?
Okay.
All right.
Okay.
Let me just step outside for a second. I'm just going to wash my hands. Okay?
Okay, great.
Thank you. I tried my best to interview Bethina as Sharon Smith in an unrehearsed fashion as much as I could, so you can get a sense for how I was thinking through the case. Lots of pauses and ums, and I think you probably could hear my brain churning as I was going through the case. And if we were to map my clinical reasoning, before I saw the patient, I kind of reviewed the chief complaint that I knew. I knew that she had come in with abdominal pain. I went over the framework and I asked myself, do I know all the illness groups that are relevant in this case? When I started talking to her, I fully characterized the abdominal pain, considered the risk factors for abdominal pain like NSAID use and alcohol use. And during that time, I tried to ask all the relevant GI review of systems questions. I was considering alcoholic pancreatitis early on in the history taking. There was also some possibilities of gastritis and or a miliary Weiss tear given her history of um, blood in the vomitus as well as a prior history of melena. but I wanted to make sure I didn't miss any of my alternative diagnoses, so I pursued those questions, considering the possibility of gastroenteritis, myocardial infarction, pneumonia, biliary disease, pyelonephritis and cystitis, nephrolithiasis, menstrual disorders, and ectopic pregnancy. And in any woman who is of childbearing age, you really ought to consider um, doing a thorough OBGYN history in any patient with abdominal pain. I then proceeded with the past medical history, and here the history of prior cholecystectomy was certainly relevant, so it was good that we got that history from the patient. I delved further into our alcohol use in the social history using the Cage questionnaire, and I didn't pursue the Cage questionnaire early on because I wanted to make sure that I had some time to establish a relationship with her, because these are questions that are kind of difficult and maybe uncomfortable for some patients to answer. But I think we got a sense for what her alcohol use is normally like. I then completed the review systems, paying attention not to repeat any of the questions I had already asked. Otherwise, your patient may feel like you haven't been listening to them. So, my provisional diagnosis at this point, prior to doing the physical exam, is this patient may be presenting with alcoholic pancreatitis plus or minus Mallory Weiss gastritis, and she's middle-aged female, and there is some concern for possible alcohol use disorder based on how she answered the Cage questionnaire. So I hope that by enacting this history taking with you on the patient that you've prior taken a history of, I hope that you get a better sense for how a more seasoned clinician approaches the history taking in a hypothesis driven fashion. So, thank you for your attention. I hope this will help you in your subsequent sessions.